So good afternoon. We'd like to welcome everyone to the Center for Biomedical and Minority Health Research Community Engagement Core November Health Education Seminar entitled Together We Can, Screening, Prevention, and Support for Colon Cancer.
Texas Southern University's Center for Biomedical and Minority Health Research Community Engagement Core is funded by the National Institute of Minority Health and Health Disparity Research Center for Minority Institutions program. The CEC works directly with communities to identify and address health-related concerns and reduce health disparities related to ethnic minorities. We provide health education and partnerships with healthcare systems, federally qualified health centers, community and faith-based organizations. For more information, visit us on social media at CEC Texas Southern U or give us a call at 713-313-1233 or send us an email at cbmhrcommunity@tsu.edu.
Okay, so first and foremost, again, we want to welcome everyone and thank you for joining us today. We do ask that you remain muted throughout the presentation because there will be a Q&A at the end. And throughout the presentation, you can always post your questions in the chat box. And also, we hope that everyone stays on with us because we have a CEC virtual bingo where you have the opportunity to win a few prizes. So make sure you stay tuned. Next, we'd like to recognize all of our partners that make these health education seminars possible. First and foremost, we'd like to say thank you to Canopy Survivorship Center. It's a community of hope, healing, and empowerment, which enhances the quality of life for those individuals affected by cancer, as well as their family. This location is located in Memorial Herman, the Woodlands, and it's a first of its kind survivorship center, which started back in 2016. There are a number of programs and services available to all individuals diagnosed with cancer and their family members completely free of charge. Next, we'd like to say thank you to Harrington Senior Living Center. This is where we are hosting our hybrid location, our hybrid seminar today. So we'd like to say thank you to Harrington and also the residents for joining us today. And next, we'd love to say thank you to Legacy Community Health. They are our partners in helping us to coordinate our hybrid session with Harrington. It is a fully federally qualified health center that identifies unmet needs and gaps in health-related services. And they also develop client-centered programs. And so now I'd like to turn it over to Ms. Denisha Prim, who is our Legacy representative, to tell us a little bit more about Legacy.
Hello, thank you all so much for having me. I really appreciate that. Thank you again. I'm going to go ahead and share my screen just so I can give you guys some information about Legacy. All right, okay, can you guys give me a quick wave or a thumbs up if you can see my screen?
I can see it, Ms. Denisha, thank you.
You can see it? Okay,
yes.
Great. Thank you so much. All right, so real quick, yes, my name is Denisha Prim and I am the Community Relations Manager with Legacy Community Health for our 5th Ward location and also our newly 3rd Ward location, which is inside the Harrington building. And so we have a number of different services. I'm very thankful to go over all of our services, but right now I just want to give you some information about our mission. We basically drive healthy change in our communities, and our vision is connecting our communities for healthy care every day in every way. So we are truly a community organization. We're not just a clinic. We are a community organization that does a lot of different things all over. And so basically who we are a federal qualified healthcare center. And so what that means is that we service all over Houston, Deer Park, Baytown, and Beaumont, and we are patient-centered medical home. And so basically we're primary care. We service all the needs for all family members in the home. We tailor our services to meet the needs of each patient, regardless of their age, their sex, their race, ethnicity, sexual orientation, gender identity, and their ability to pay. And so as you can see here, this is just what we are in a nutshell. And so as you can see, primary care is what we are. We also have behavioral health, optometry, and just everything all under one roof. Under several different locations, there are different service lines depending on the location you choose to make your appointment. And so basically with Legacy, we offer primary adult care and senior services. We offer pediatrics, OBGYN, maternity, behavioral health, dental care, vision services. We do vaccination and immunizations, HIV, AIDS, and STD screenings and treatments. We have labs, x-rays, free education outreach to our patients, prescription assistance programs to our patients, nutritional assistance services, social work services, and family planning services. And so that's basically all the services that Legacy offers with different locations. In our senior clinics, which is one of our clinics in the Law Harrington building, and we will be having some other senior clinics coming up soon. But our senior clinics, we see patients without Medicaid or without Medicare or Medicare, geriatrics. And so with our geriatric providers, we specialize in taking care of our older adults. They are trained to make sure they're taking care of older adults. We do adult vaccination and COVID vaccines. We have open availability, so you're able to call in and make an appointment at any time. And we do have longer exam room times to build client-provider relationships. And that's really important. We want to make sure that you have the opportunity to speak with your provider, and we're not just rushing you out. We want to make sure that you are having that relationship with your geriatrician. And for our social work services, as a Legacy patient, that's one of the perks, is that you get a chance to meet with the social worker if you're in need of any type of assistance. So we have case management services, school advocacy. If you have children who are in school and they're needing some type of support, whether a social worker needs to go and help them with any type of IEPs, anything of that nature, that's what our social workers are there to do, is to help provide that support for your students. We also offer assistance with basic needs. We partner with the Target Hunger and with the Houston Food Bank, also for different sheltering and clothing. We have substance abuse programs, financial assistance, legal assistance as well, transportation, employment assistance, domestic violence, and SNAP application on site as well. And so that's part of our social work services. So again, if you're a Legacy patient and you're needing any type of social work services, all you have to do is let your provider know, and then you will immediately be able to have an appointment with our social work department, and they can help you in one of these areas. As far as our payments, we do accept patients regardless if they have insurance or not. We do accept most medical health insurance plans, Medicaid or Medicare. We also have the marketplace options available, and then we have sliding scale fees available for all services. And we have eligibility. So if you don't have insurance, the first step is to go through eligibility so we can see where you fall in at to help you with any sliding scale fees or grants that may cover some of the medical costs, just depending on your finances. Okay, and then there's our information for general care services. You can call that number 832-548-5000, or if you're looking for senior care services, that's the number to call for seniors, 713-814-3750. All right, thank you so much, and that concludes my presentation.
Ms. Perm, thank you so much for that wonderful information. And hopefully we can put your name and information in the chat box and be able to send that out to everyone in case they want to follow up for more information.
Okay, I'll do that. Thank you.
Thank you. All right. So at the end of our presentation, we'd like to always remind everyone that we do have a survey. We do ask that you click on the link that's provided to you in the chat box to complete the survey about today's seminar. The first 10 attendees to complete the end of seminar survey will be eligible to receive a swag gift bag from our center. So we have the link in English and in Spanish. So now I'd like to introduce everyone to our speaker for today. Ms. Oluwaseun Akeredolu, also known as Seun Arise, is a remarkable, resilient, and inspiring woman of God with great faith and courage. She is a board certified family medicine physician assistant for over 10 years, completed her undergraduate studies at Texas A&M and attended Baylor College of Medicine for her graduate studies. So her clinical expertise includes primary prevention and management of chronic conditions, including hypertension, hypercholesterolemia, and diabetes. She is passionate about educating her patients on prevention and screening of cancers and chronic diseases. And she uses her skills and gifts of compassion to encourage and empower her patients. She's an author and motivational speaker, overcome several major setbacks in life, and by the grace of God has emerged stronger and is thriving in all areas. She's created a charitable organization aimed at helping women arise, recover, and reign through biblical principles that empower women to get out of the rut and experience the best life that God has for them. She is the founder of AO STEM, a 501c3 nonprofit created to support underrepresented minorities in science, technology, engineering, and math. And when she's not serving her patients, women in her community, or in her church, she's serving her two beautiful children. So, Michelle, I'd like to turn it over to you. Thank you so much for being here with us today.
Thank you so much, Dr. Lau, for having me. I do appreciate each and every one of you for joining from wherever you are today. And my task today is to speak to us about colon cancer prevention and screening. So we're going to get right to it. I'm going to start sharing my screen. As Dr. Lau said, I am a physician assistant. I've been in practice in primary care for over 10 years. And when Mrs. Prim was talking about primary care and taking the time to, your providers talking to you. I really appreciate that because that's what I do, getting that one-on-one time. You never feel rushed. So if you get a chance to get in touch with Legacy, go ahead and do that. So today we'll be talking about colorectal cancer screening and prevention, like I mentioned earlier. You'll hear me use the term colorectal cancer, colon cancer interchangeably, but we're talking about the same thing. All right, so today we have a few objectives. So essentially, first one will be to define what colorectal cancer is and to talk about how we detect it. We'll also be talking about risk factors for colon cancer. Also, by the end of this webinar today, you should be able to know the different ways, the different tools we screen for colon cancer or colorectal cancer. And lastly, you'll be able to know the benefits of the guidelines recommended by several major organizations in the US. So what is colorectal cancer? So we can't talk about colorectal cancer without talking about the colon or the large intestine. So essentially the large intestine is connected to the small intestine, which is connected to your stomach. So essentially it has different parts here. So the first part is the ascending colon, then the transverse colon, which kind of runs under your rib cage, and then it curves downward as the descending colon, and then the last portion of it is the sigmoid colon, where then the colon exits the body and allows feces to exit the body. So the colon has its own functions, right? So the stomach has the ability to hold your food and start to break it down. And then it goes through your small intestine where a lot of the digestion occurs and your body absorbs the nutrients from your food. When all the nutrient absorption is done, all that waste, then it's gone, it goes into the large colon, the large intestine or the colon, where the body begins to reabsorb fluids. Okay, it reabsorbs fluids, it processes the waste products from the body, holding them and preparing to eliminate them from the body as a form of a bowel movement. Okay, so what is colorectal cancer? We talked about what the colon does. Colorectal cancer is essentially a cancer of the colon. And this essentially occurs when there is unchecked division and survival of abnormal cells. How does this happen? So every cell in our body has the ability to grow. Most of the cells, there are some cells that can no longer grow and divide, but for the most part, the cells in the colon are able to grow and divide. And our body has, it's amazing, God made it such that there are checkpoints in the body and checkpoints in the cell division, cell cycle. So as the cells divide, there are certain gateways or checkpoints that allow the body to check for damages in the DNA that have occurred for a number of reasons during the cell division. And when this cancer, when these abnormal cells divide uncontrollably, they are able to then override those checkpoints and then become colon cancer. So here's just an elaborate description of what I just said. At least five different checkpoints, and cancer cells are just able to manipulate their way, across those checkpoints and get away with that. So how does colon cancer develop? Just more on a global scale, right? Not talking about the cell level. Colon cancer, or any cancer, really happens when there is damage to the DNA. So this damage we call mutations. Mutations can happen for a number of reasons, whether it's because of chemicals or toxins that we come across. It's then absorbed into the body and causes DNA damage. There's also radiation that can occur, especially when you talk about skin cancer and other types of cancer. Really, radiation can cause DNA damage as well. You also have lifestyle factors such as your diet. Believe it or not, your diet, lack of exercise, those things can cause, they can lead to changes that can cause mutations in the DNA. And lastly, damage to the DNA as a result of your genetics that can occur. So once this damage occurs to your DNA, then, like I mentioned earlier, there's a disruption of that cycle. So remember that those checkpoints are there to make sure everything is progressing well. When this damage occurs, those cancer cells, or those abnormal cells, are able to essentially get rid of the brakes, right? Get rid of those checkpoints and override the cycle systems. And then that can lead to abnormal growth, because those cells will continue to grow uncontrolled, and they can lead to cancer. Okay. Now, colon cancer, if you've heard of it, it's a cancer. Like I said earlier, it's a growth. Basically, abnormal cells lead to abnormal growth, which then spreads as cancer or metastases. And it can, as with any other types of cancer, there are stages of colon cancer. The first stage is essentially when that growth, that abnormal growth, stays in the first layer, the first lining of the colon. As you can see here in this picture, it's stage 0. It hasn't really extended far. And then the first stage is stage 1, where then it continues to grow, actually grows inside, and then it progresses to where it starts to invade the cells outside of the colon, which is then connected to other parts of the body. So colon cancer can, just like other cancers, progress through these stages and spread throughout the body, unfortunately. So we can't talk about colon cancer and screening without knowing what the symptoms are. So when someone is diagnosed with colon cancer, it's not something that happens overnight, right? There has been this abnormal cell changes have occurred over time to the point where now they're producing symptoms, right? Some people may have blood in the stool. That's one of the more common symptoms. Here you see a list of about 7 symptoms here. So blood in the stool is one of them. Rectal bleeding. So if you have any of these symptoms that I'm talking about and you don't know why, if you have them, period, whether or not you know why, you probably should talk to your doctor or your primary care about that. Some people will also notice change in their bowel habits. So just imagine when that growth is there in the colon, a formed stool, a stool that used to be a certain way may change its consistency, may change its shape. So that's something to be aware of. Also, people will start to have abdominal pain, especially when the cancer has advanced beyond stage 2 or stage 3. Unfortunately, one of the later symptoms, it's really a sign of poor prognosis or poor outcome, is decreased appetite. So, and that's very common, decreased appetite and unintentional weight loss, very common for all types of cancer, because just imagine uncontrolled division, the cells grow out of control, zapping the energy from the body, zapping nutrients from other cells that need it. So someone starts to lose weight, they become easily fatigued, and they present, unfortunately, with later stage colon cancer. So let's talk a little bit about trends. So I thought I'd share this with you. There's some interesting facts The red ones are the ones I'm going to focus a little bit more on, but colon cancer is the third most common cancer in the United States. It's also over the lifetime, one in 20 Americans will develop colon cancer. So it's about 5% of Americans. Since the 1980s, mid-1980s, there's been a decreased incidence in colon cancer, which means overall, there's not a whole lot more, right? The occurrence of colon cancer in the general population has decreased. However, in younger adults, we've seen that kind of the opposite of that occur. We're noticing more and more colon cancer being diagnosed in the younger adults. And when I say younger adults, I'm talking 50 and under. In the past, we used to screen patients 50 and above for colon cancer. A few years back, about late 2018, I believe, that age was decreased to 45 for this specific reason, because younger folks are now in their 20s, sometimes in their 30s, are being diagnosed with colon cancer. A number of reasons for that. Still under, a lot of studies are still being, there's a lot of studies going on about that to try to figure out why is it that younger adults are getting colon cancer. Is it the foods we eat, chemicals in our environment, radiation? We don't know. Also, I should point out that mortality rates, which is basically the rate of dying, the rate of dying, the chances of dying from colon cancer has really decreased over the past 20 years. Thank God for technology and science and research that has been done over the years to come up with new therapies that can target the DNA, the places where DNAs have been damaged, or target those cancer cells to stop them from growing. I think I really like to point out here is that, unfortunately, even though overall the rate of mortality rate has decreased over the past 20 years, there's a higher mortality rate in African Americans. What does this mean? This means that an African American who gets colon cancer is more likely to die from it than someone who's Caucasian, for example. So things to just kind of keep at the back of your mind. It was estimated by the American Cancer Society that in 2021, this year, there will be at least 149,000 new cases of colon cancer, and at least estimated about 53,000 people will die from that. So it has a heavy burden in our society. Let's talk about risk factors for colon cancer. So who gets colon cancer? What makes you more likely to get colon cancer? There are a number of factors, and we can divide them into factors that we cannot change, such as, we call those non-modifiable risk factors. These are things that you can't change, such as your age, right? We can't change our age. Sometimes we wish we can go back in time. Also, family history. You don't get to choose your genes. You don't get to choose who your parents are. So that also has a bearing on your risk for colon cancer. Radiation exposure. Sometimes we can't change that. Again, if someone has had colon polyp or colon cancer, their risk also goes up. And then there's other conditions like Crohn's disease and Crohn's disease that can essentially increase your risk for colon cancer. Some factors that we can change, and this is where we'd like to kind of focus on today, there are factors that you can change to decrease your risk for colon cancer, such as physical activity, making sure that you're in the right weight range for your height, and having type 2 diabetes, right? So preventing these illnesses, and also stop, if you're smoking, you definitely want to make sure that you quit to reduce your risk. And of course, the biggie here is our diet. So just to kind of reiterate, on the non-modifiable risk factors, the factors that we can't change, males are more likely than females to be diagnosed, but they're pretty close. 1 in 23 males, 1 in 23 males will get colon cancer, or 1 out of 23. And then if you look at the females, it's 1 in 25. So it's pretty close. When we talk about age, 90% of people who are diagnosed with colon cancer are 50 and above. So this is why we used to screen for colon cancer starting at age 50. But like I said earlier, we've started now to try to find out why there's a higher number of that 90%, that group under 50. Why are they getting more colon cancer diagnosis? Because of that, they've reduced the screening age to 45. Again, you can't change your skin color, you can't change your race. So African Americans are more likely to be diagnosed with colon cancer. That's a risk factor. And then this is an interesting one. Night shift workers, or people who work nights, they're more likely. And that's probably because it's not normal. Our body isn't set up that way. So that's probably due to inflammation and changes in lifestyle. Also, I find it interesting that folks who live out in the South, Midwest of the United States are more likely to be diagnosed with colon cancer than those who live in the West. Some people have said it's probably because of our diet, probably because we eat more meat in the South here. Or if you kind of look at where ethnicity-wise, there are more African-American down in the South. So that could also be another explanation for that risk factor. Again, looking at non-modifiable risk factors, your family history of if there's someone has had colon cancer in your family. Some people have a condition called Lynch syndrome, where they just get a lot of polyps in their colon. Those are more likely. Again, inflammatory bowel diseases such as ulcerative colitis. These are conditions that cause a lot of inflammation. Ulcerative colitis and Crohn's disease cause a lot of inflammation, a lot of disease and disorder in the colon. So because of that inflammation, that can lead to DNA changes that can cause colon cancer. And of course, type 2 diabetes, it's not well understood what that is, but we do know that people who are diagnosed with type 2 diabetes are more likely to be diagnosed with colon cancer. So how can you reduce your risk for colon cancer? We know that 55% of all colon cancer or colorectal cancers are due to lifestyle factors, right? So remember that slide I showed you before. You can't change your age, you can't choose your family, you can't choose your genes, but you can change your lifestyle. So smoking, so you want to make sure that if you're smoking, talk to your provider about how you can quit. There are ways, there are medications out there, therapies out there that can assist you with quitting smoking. Also, high alcohol consumption is not advised, right? To reduce your risk, if you're drinking as a female more than 1 serving of alcoholic beverage per day or more than 7 per week, and if you're a male, if you're drinking more than 2 servings per day or more than 14 drinks per week, then your risk goes up. Also, when we're talking about factors that we can change, your diet is important. So red meat intake has been linked to increased risk for colon cancer. This is probably because it's really hard for the body to digest it. It's not well understood yet, it's still being studied, but we do know that diets that are high in meat, red meat, do tend to increase someone's risk for risk factors. Again, talking about lifestyle, processed foods, a lot of packaged foods, a lot of these foods they have a lot of saturated fats. They have a lot of chemicals now in our foods. So those, processed foods definitely increases your risk. So we always recommend that as much as possible, try to eat clean, right? If you shop around the grocery store versus inside the aisles where things are less processed. Physical activity is a biggie. We know that physical activity is beneficial because it helps you to reduce your weight so you can be at a healthy weight. Moving also helps with reducing your risk factor. So we've talked about, the risk factors. We've talked about the trends. We've talked about how, colon cancer can start, but how do we screen for it? How do we find out if someone has had colon cancer? When we screen, we are looking for a couple of things. The main goal of screening for anything in medicine or primary care is to find asymptomatic disease. Essentially, that means look for something before it really starts. Look for indicators. And we also want to screen so we can prevent it. In this case, I mean that if I have a 45-year-old male, African-American male, or any male come to my office, I am going to screen them for colon cancer if they've never had a screening, looking for signs, whether through the screening test that we're going to talk about, trying to see if they have precursors that can lead to colon cancer. Some of those precursors are, abnormal changes in their colon lining. Certain biomarkers like DNA, blood can also indicate possible colon cancer. So when someone gets screened for colon cancer, if they have polyps, if polyps have developed, they are able to, address that and prevent colon cancer. Because if you remember in those pictures, everything starts in the cell and the cell divides. And if there is a polyp, sometimes until you actually remove a polyp and look under the microscope, you don't know exactly you don't know for sure what it is. So if there is a polyp, it's removed so you can prevent it from developing cancer or spreading. Also, when patients are screened, particularly with a colonoscopy, they are able to remove any early cancer lesions or polyps that may have occurred, so that they can stop the spread. And screening can also be used to diagnose colorectal cancer. Of course, that's not what we want. We want to prevent it versus diagnosing it. So the screening tools for colon cancer can be divided into 3 types. We have the stool test. Basically, you submit stool sample to your provider or to a lab, and they look for they look for blood, they look for biochemical markers that can that can indicate cancer or polyps. The second type of tools are imaging tests. So these are like barium enema. So this is basically where you drink a liquid and they take an X-ray of your abdomen, of your colon, try to look for some signs that can indicate cancer. They will look for like something that could look like a lesion or a mass. But the CT colonography, essentially the same thing, where they're having you drink something and they're doing a CT scan of your colon. The last type of set of tools are your procedures. So this is where colonoscopy is in red, because that is what we favor. We always recommend a colonoscopy, and I'll tell you why shortly. But flexible sigmoidoscopy is essentially when a provider or specialist looks just at the sigmoid colon. Remember the last part of the colon, they just look at that to try to diagnose rectal cancers. Of course, I'll tell you a little bit more about colonoscopy. So basically, with the first group of tests, like I mentioned earlier, they look for blood, what we call occult blood, that cannot be seen with the naked eye. So it is possible for someone to have blood in their stools and you not know. Some people will come with, for a number of reasons, people will have blood in their stools, like hemorrhoids or if they have ulcers. But sometimes patients you can't see that. That's why it's so important not to assume because nothing is wrong, I won't go to the doctor. So make sure that if you are of that age, you definitely want to make sure that you're getting in to see your doctor. With these stool tests, they can be done anywhere from they will require an office visit. Typically, for these ones here, they would require an office visit, but you may have to collect 1 to 3 samples in order for, to get a really good sample. The problem with these tests is that they can be affected by your diet. So if someone eats something that doesn't sit well with you and there's some inflammation or some bleeding for whatever reason, that can cause a false positive, and which will then lead to unnecessary testing and screening. But also they can miss a lot of polyps because sometimes there are colon cancers that don't bleed until it's late, or some bleed every now and then, what we call intermittent bleeding. The last type of stool test is a Cologuard, and I'm sure you guys have seen this guy here on your TV, or you see him every now and then. This is Cologuard. It's a relatively new tool. It's a stool test, and it's relatively new on the market. It's a DNA test. This is good because it detects not just blood, but it looks for DNA and 11 other biomarkers, including blood, that would indicate colon cancer. Those would not only indicate cancer, but they can also look for certain types of polyps and DNA changes. This is a good test because it's very sensitive. If you see here, compared to the other types of tools, stool tests, it has 94% sensitivity. That means it's likely 94% of the time it will catch a colon cancer. So that's pretty good. Now, the downside to it is that it can still miss some colon cancer. So you see here, the ability of a Cologuard, which is a pretty good test, the ability to detect precancerous polyps is only 42%. And this is why we always recommend a colonoscopy. A Cologuard is good enough. It's really good enough. You can do it once every 3 years. But if you can, particularly for my African-American patients, I don't ever recommend that you do a Cologuard. I always want you to do a colonoscopy. So let's talk about a colonoscopy. A colonoscopy is essentially a test that allows the gastroenterologist or the specialist to look inside your colon with a camera. There's a long tubing of camera that is inserted through the rectum, and they wind it up all the way through all the parts of the colon so they can see everything. And I think this is great because they're able to look, right? Not just test for polyp and see if, possibly there's bleeding, but it really gives a visual exam of a colon. So it is the gold standard, meaning it's what we recommend. It's used to diagnose, right? It's used to screen, to diagnose, and it's also used to treat colon cancer. This is therapeutic because when they go in, they're able to see whatever is there. If something is there, they are able to take it out and determine exactly what it is. In patients who do have cancers, they do colonoscopies, and with some types, with some sizes, they're able to actually remove the cancer in the lower stages, like a stage 0 to stage 1 or 2. They are able to use a colonoscopy to remove the cancer. So what does it involve? What does it take to do a colonoscopy? So when you have to do a colonoscopy, it usually means you're probably going to be out of commission for the day, or at least half of the day, because the night before you're going to drink a bowel prep to clean out your colon, right? This is one of the reasons why people tend to shy away from a colonoscopy, because they have to clean out your colon, essentially get diarrhea the night before. And you have to, you have to go into this, the surgery center or the hospital where it's going to be done, and you will be sedated. So it's not something you can do at home by yourself. This often means if you work, you have to take a day off and you're going to need a ride. So this is another limitation why people don't want to get a colonoscopy, because they have to find a ride. But there are always ways around that. But one of the reasons we love colonoscopy and why it's a gold standard, it's because it's the most sensitive in not just detecting cancer, but detecting polyps, right? Again, because polyps are growths that you can see. And here, I just wanted to point out, this is really fascinating. When you look at the tubing that it has the light so they can see, it has a magnifying lens here, and they can also put tools through here to cut, to clip, whatever they see. So here's another slide that basically gives you a really good visual of what it is, right? So they insert the tubing, which has the camera, and they look through the entire length of the colon. And here's a picture of a polyp. And this is like a little, I don't know what you call it, like a little hook there, or the hook to catch the colon, to catch the polyp, the colon polyp, and they are able to snip it, like you can see in this animated picture. So this is why you want to get a colonoscopy, because they can see everything. They can tell you how many polyps, they can tell you exactly where they are versus some of the other tests. So let's talk about screening guidelines. We've talked about the screening test. Let's talk about the screening guidelines. This slide's may be a little bit busy, but let me just highlight a few things. The most important thing to get from this slide is this. If you are 45, you definitely want to get, you need to start getting a colonoscopy. If you're 50 or above and you haven't started, you definitely want to talk to your provider about how you can get one, okay? Recently, the American Cancer Society a few years ago decreased their age when we noticed that there are more younger folks getting colon cancer. They decreased the screening age to 45. What I find interesting is that prior to that change, African Americans used to start at 45, but we're still waiting for them to lower the screening age, hopefully to 40 for African Americans. Here again, these are for someone who has an average risk, okay? So let me point that out. For someone who has an average risk of colon cancer, you want to start at 45. There are people most people have an average risk, and some people have a high risk. What do I mean by that? an average risk, someone who has an average risk of colon cancer is someone who does not have a family history, meaning their first degree relative, like a mom, a father, a sibling, they've never been diagnosed with colon cancer. That's someone with an average risk. Someone who has, who does not have a history of Crohn's or ulcerative colitis, those are people with average risk. So most people are going to fall under that average risk. Let me just, so this part here is just pointing out that if you've had, let me just point out, so this tells you when you get those other tests that I mentioned. A Cologuard is once every 3 years. A colonoscopy is once every 10 years. But if they find something, they can tell you, oh, you know what, why don't you come back in 3 years or 7 or 5? And that's what I personally like about a colonoscopy. It's really, you get a personalized follow-up instead of a general, oh, everything's good, we'll see you in the next decade. Also, if any of those tests that I mentioned earlier, even the Cologuard is abnormal, then you have to get a colonoscopy. So why not just start with the best test, right? That's what I say. So let's talk about high risk. So someone who has had a family history of colon cancer, that person it wouldn't be recommended to start that person at age 45. The age where we start that individual depends on when that family member was diagnosed. So say Sue, if Susie had her mom was diagnosed with colon cancer at age 50, well, we're going to backtrack and say, okay, Susie, you need to start getting your colonoscopy at age 40. So we will start 10 years before that family member's age. And this, again, those people can be screened every 5 years. So just keep that in mind. And I want to point out here, people who've had Crohn's disease or ulcerative colitis, they usually have to get a colonoscopy every 3 years anyway. So those are your high risk population. Again, here is an overview of the screening test. I think it's really important to point out the frequency. If everything is good, they usually will tell you every 10 years. A lot of insurance will only cover colonoscopy, meaning cover it 100%. As a preventative test. Remember, these tests, whenever we screen for something, whether it's screening for diabetes with your annual physical, screening for breast cancer with the mammogram, screening for colon cancer with a colonoscopy, those tests should cost you zero because it's a preventative measure. So your insurance will cover a colonoscopy once every 10 years, and these other tests every few years, depending on which one is done. So I like to address top 6 screening barriers that I've encountered in my practice. So over the years, patients will tell me, I don't want to get a colonoscopy, or I can't get a colonoscopy for these reasons. The first or the 6th reason is I don't have a family history, right? Well, no one in my family has had colon cancer, so why should I bother? Well, you should still screen because most people that have that are diagnosed with colon cancer have never, they don't have a family history, right? So again, remember that there are a lot of factors. It's not just your genes that determine whether or not someone will get colon cancer. There's lifestyle issues, right? So whether or not you exercise, what your diet is like, whether or not you smoke, whether or not you have diabetes. So there are many other factors that can affect your risk. It's invasive, right? Why go to the trouble of getting a procedure done? Well, why not? If you talk to patients who were diagnosed with colon cancer later, they'll tell you, I wish I could have been getting it sooner. So it's invasive, yes, but the risk is very low. There are risks with doing certain procedures, but it's very rare that you come across a complication such as perforation and things like that. It's a very common test that's done. It's done in an outpatient center, and this shouldn't be a reason not to get a colonoscopy. Some people will also tell me it's too gross. Well, you just have diarrhea. People have diarrhea, if you eat bad food. So just get a medically induced diarrhea to clean out your colon and get everything checked out. You really don't want to go through that, right? I've had patients who didn't drink the little liquid, bottle of liquid they were supposed to drink, and they had to go back because they couldn't see very well, right? They had to repeat the whole thing. So just, chug it up and do it once and for all. And also, when you look at the benefits, you want to make sure that we're doing this to prevent colon cancer. It's much more difficult thing for someone to, delay screening and then be diagnosed with colon cancer. And then there are other things, right? When they have to take out the colon and then people have to wear a bag, right, to kind of hold the stool. So that can be far worse things aside from a colonoscopy. One third thing I hear is that, oh, the PrEP is awful. So the PrEP is a solution that people have to drink. Thank God for technology, right? That solution used to be about a gallon size, but has now reduced. So you don't have to drink that amount of liquid anymore to be able to get the PrEP done. So it may not taste very well, it may not feel good, but it's for a good cause. It's too expensive. Now, this should not be an excuse. It's like I mentioned earlier, it's a prevention method, or it's a preventative screening. So it should cost you $0. Now that may change if they, do a colonoscopy now and they say, well, come back in a year or come back in 3 years. Then you may have to share costs with your insurance. But again, you can't, you can always figure a way around that. And of course, we're still in a pandemic. And especially last year, I heard a lot of patients say, well, we're in a pandemic. Thankfully, now there are vaccines, as the COVID vaccine. So it's something that should not stop you. Everyone's now going out to restaurants, you're going to places, you're taking precautions. So just like you would go to your doctor's office right now if you're sick, they're also taking those precautions in those surgery centers. So you should have no barrier to preventing you from doing a colonoscopy or any colon cancer screening for that matter. So that's pretty much the end of my talk today. I wanted to basically just quickly recap. Colon cancer is it's true, it's a reality, but it doesn't have to be your reality if you stay on top of your screening. Make sure that you are, in touch. You see your doctor at least once a year during your annual physical. They talk to you about it, about your personal risk factors, and order the appropriate tests for you. If you can, I always encourage you to go ahead and get a colonoscopy and, take care of yourself. Also, take measures to reduce your risk of getting colon cancer. Make sure that if you are smoking, you work with your provider to quit. Make sure that you're eating well, you're eating healthy, to keep your weight at a healthy range. And also, if you have any chronic conditions like high blood pressure, or particularly diabetes, work on making sure that that is controlled. And that is the end. That's all I have for you. Does anyone have any questions? Not sure.
Yes, ma'am. Pastor Shion, thank you so much. That was wonderful. I learned so very much. So we do have a question. We had a lot of people commenting about the comments and the stats and just learning a lot. Miss Marianne has a question, and she wanted to know, how often should a Black female over the age of 70 who works out be tested?
That's a very good question. Let me just take out one part of that question that should be irrelevant, in a sense that it shouldn't matter. The working out part, whether or not you work out, your body, it's good that you work out. It's good for your body. It reduces your risk of certain cancers. We know that, particularly obesity as a risk factor, it reduces that. But your body, the cells don't know that there are still other factors aside from being sedentary. For a Black woman who's over 70, that is a very good question, because at that age, we start looking at longevity, like how much more, what is the life expectancy of that patient? So if, you talk to your provider, if everything is good, there are no other comorbidities, there's no diabetes, no other chronic issues, you may still be a good candidate for a colonoscopy. In those cases, though, it's if you've had a clean bill of, if you've had clean colonoscopies up until that point, they may determine that for you, it's okay to go ahead and do a Cologuard. But I wouldn't, for a Black female, as much as possible, if there's no major contraindication, no major reasons why not to, I will always recommend a colonoscopy, but definitely talk to your provider about that.
Okay. And let me see if there are any more questions. So I know for myself, I learned quite a bit. And so I thank you so much. One question I have, so I spend a lot of time in the holistic community. So I have a lot of people I know. And so one of the things I'm always hearing are the benefits of colon irrigation or colon hydrotherapy. And so I'm just wondering, do you have any thoughts about that in relation to colon cancer?
So I don't have any scientific data, but I can tell you just colon irrigation is essentially just clean out your colon, right?
Okay.
They go in different methods and they go out and clean out the colon, but that doesn't really take care. It doesn't address the risk factors, right? It empties out your colon. If that's all that's needed to prevent colon cancer, then that'd be great. But unfortunately, it does not address the risk factors. It does not address the genetic component. It does not address the cellular changes that occur, the DNA damages caused by toxins, lifestyle issues, and such. So that's not a reason to not get a colonoscopy. It will not prevent colon cancer.
Okay, thank you so much. And just one last question. I don't know if anyone else is maybe wondering, I've never went through the process of a colonoscopy, but is there any pain after the process is over?
So I have not, I can tell you that I have not either, but so if we look at the procedure, how it's done, you're sedated. They're going to give you medication just as though you were going in for any procedure. It's literally the actual procedure is like less than 30 minutes, but you may be sedated. They want to make sure that you're calm, right? You're not going to be totally put out. Some patients do request that they be put out completely, but patients do kind of talk, and I've had patients come back saying that they were telling jokes during it, but you are sedated during that procedure. So, and they're just looking through the colon, right? So unless maybe they take something out, or they found other issues or there were complications, it really should be painless. I've had patients do it. They take a day off from work, the next day they're back at work. So it really, there's no pain really that should be associated with that.
Awesome, thank you. And I'm looking, as you were speaking, we have we have two attendees who said no pain.
Okay. Yeah.
I've had several,
Yeah.
I've had a colon and there's no pain. So that's comforting to know.
Yes, absolutely.
All right, thank you all so much. And thank you, Michelle, for your informative discussion. Now, next, we're gonna get ready to go and play some virtual bingo. So don't leave us, Michelle, because the words that we have, I love for you, if there's something there, you kind of touched on a lot of these words, and to just kind of reiterate the importance of maybe this word with the topic.
Okay.
Let me go ahead and share my screen again real quick. Right. And so the link should be in the those who will be joining us and playing bingo. What is this? Okay. All right. So if you have your bingo cards, it should be a virtual bingo card that you get via the link. So we ask that you go ahead and copy that link, open that virtual card, and play along with us. So the first word is diagnose. Diagnose. So Michelle, what do you want to tell us about this word in relation to the topic?
So diagnose essentially means to determine what's causing it, like determine the cause of something. So in this case, or determining that something is there. So in this case, when colon cancer is diagnosed, they confirm that indeed that cancer is there, the abnormal growth is there that has developed and that needs to be taken care of. So when colon cancer is diagnosed, you're almost always going to have referral to an oncologist to talk about treating it.
Awesome, thank you. All right, so the next word is exercise. You talk to us about this, exercise.
So exercise, I'm sure we all know what that is, right? It's moving, it's physical activity. Exercise is huge when we're talking about any prevention, whether it's cancer or any chronic disease, such as high blood pressure, diabetes, high cholesterol, and even some neurological issues like dementia. Exercise is a great way to keep your body in shape as far as your hormone levels. Make sure your insulin, like your pancreas is responsive, your body's responsive to insulin, to make sure that your organs are getting perfusion. And it's just really important to get exercise, get moving. You don't have to do anything strenuous. You don't have to join a gym. You can go for walks. It's recommended to do at least 150 minutes of exercise weekly. So basically walking 30 minutes 5 days a week is enough. Of course, if you can do more, do that. But it's recommended to exercise regularly to decrease your risk for a lot of cancers, especially colon, and also decrease your risk of heart disease.
Okay, thank you. So the next is counseling.
Counseling. So counseling is a very broad word. It's I do a lot of counseling with my patients. So when I have a patient, I'm talking to you one-on-one, I'm counseling you about your risk for diabetes, and I'm recommending what you need to do. I'm recommending a test for you. We can take that to other parts of our health as far as mental health counseling, but essentially counseling is sitting with a provider and determining how to handle a situation.
Okay. Polyps.
Polyps are the growths that can, they are benign growths. Well, I should say they are growths that can occur. As it relates to the colon, you can actually have benign polyps, right? And then abnormal polyps. You can have benign polyps, which are basically overgrowth of normal cells in the colon. So these polyps are benign, so they're not going to lead to colon cancer. Oftentimes, it's very common actually for a patient to go for a colonoscopy and have a benign polyp taken out. But no one's going to know that it's benign until it's seen under a microscope. So it's really important to make sure that you get screened to catch those polyps that could be precancerous.
Okay. So our next word is radiation.
Radiation. Everyone knows I think I mentioned earlier, one of the causes of DNA damage can be radiation. Radiation in our environment, certainly radiation from the sun for other types of cancers, but it's something that can cause changes or damage to your DNA and can lead to mutations that can lead to cancer.
Okay. All right. So this is just a reminder that if you are bingoing and you're virtual, please put your bingo card number in the chat or raise your hand. And if you're on site at Law Harrington, let the facilitator know so that they can call your bingo. So we're going to keep going. Next is immunity.
Immunity. I'm sure a lot of us have heard this word a lot in the last, 18 months because of COVID. So immunity is essentially a way of your body protecting itself, right? So the body does protect you from illnesses or, from measles. If your body has never seen measles before and you get a measles vaccine or even COVID vaccine, it's supposed to develop antibodies as a way to safeguard your body next time it sees whether it's COVID or measles or whatever disease that we're talking about. Unfortunately, as it relates to colon cancer, it'd be great if there was a vaccine. I mean, maybe that's years away, but there's no way to develop immunity against colon cancer at this point.
Okay, thank you. Biopsy.
Biopsy is a word that essentially means cutting out or taking out. So in a situation where there's abnormal growth, whether it's a normal polyp or a benign polyp or a precancerous polyp, those polyps during a colonoscopy are biopsies. Whenever we cut anything out of the body, we call it a biopsy. Even when someone, you take out a skin tag from your hand, they call it excisional biopsy. So biopsy is removing any growth from the body.
Okay. Well, next we have diabetes.
Great. Well, diabetes is it's an abnormality that develops over time, where there can be two types of diabetes. But as it relates to colon cancer, the diabetes type 2, which is something that occurs because of our lifestyle, poor diet and lack of exercise, it causes your body no longer to respond to insulin, means your blood sugar becomes really high. And we know that excessively elevated blood sugar can cause damages to your vessels in your eyes, in your kidney, all over your body. So it's important to make sure that we're exercising and eating well to reduce our risk for diabetes.
Okay.
Go ahead.
All right, large intestine.
All right, we've been talking about this all day, AKA the colon. The large intestine is the colon. It is responsible for absorbing, fluid reabsorption and also storing waste, carrying that waste from the, from the colon to, and exiting it and taking it out of the body. So large intestine is the colon.
Okay, so we've got some bingo callers. So let me go ahead and put in the first one. Let's take a look at the card. Oh, we've got a bingo winner right here. So way to go, Miss Marianne Donato. She's our first bingo winner. And then we have a second. Miss Seema, can you give me your bingo card number? Okay. All right. So while Miss Seema does that, I'll just go ahead and go to the next one because we've got a total of, oh, here she is. She gave me 13. Look. Way to go, Miss Seema. Awesome. Awesome. All right. And then just one couple of more. So let diet.
Diet, I'm sure we're all familiar with this word as well. Diet is your food, what you eat, right? So our diet should be clean, should be healthy to reduce our risk for colon cancer. So I mentioned earlier that one of the things that we're finding out is that a diet that's rich in red meat can increase your risk for diabetes. So you want to make sure that you're eating more white meat, so more chicken, more fish instead of red meat. Also, as it relates to your diet, making sure you eat more vegetables, more fiber, and of course, staying away from sugars that can cause inflammation as well.
Okay. All right. And so we've got one more here from Miss Inna. And let's see Miss Inna's card. Well, Miss Inna, see, I think and then we've got one more for 004. All right, so we've got our 3 winners for our virtual bingo today. And we just want to thank Michelle so very much for taking the time to educate us about colon cancer, what we need to do to keep ourselves safe and healthy. I learned a lot, so I appreciate that. Let me see if there are any other questions, and I don't see any. So I'm going to get ready to go ahead and close this out. And I'd like to remind everyone to please click on the link posted in the chat box and complete the survey about today's seminar. We use that information to help us identify the particular health disparities that you all want to focus on. And we allow that to guide us in collaborating with our partners, such as Ms. Shayon and others, to bring that information to us so that we can know how to keep ourselves healthy. So the first 10 attendees to complete the seminar survey will be eligible to receive a gift bag. And we do have the link available in English and Spanish. We would like to bring your attention to the fact that we're getting ready to have our next educational seminar December 1st. And it will focus on screening and prevention for cardiovascular disease. So we ask that you all come in and please join us again next month. Please stay in contact with us. These are all of our social media handles. You can also email us. You can text TSU CEC to 855-264-9031. This will connect you with us. So that way you always know what we're doing every month. And also in preparation for leading up to our big day, which is our annual conference in April of 2022. So I'd like to thank everyone again for your time. It's been wonderful. Thank you again, Ms. Shayon and Ms. Denisha, for sharing your information about legacy. You all have a wonderful rest of your day.
Thank you. Bye, everyone.
Bye-bye.